Good evening, everyone. We'll be starting with our presentation very soon. I'm just waiting for people to join. I'll request everyone to please mute your speaker, mute your mic and switch off your videos so that we'll have smooth transmission of the presentation. Thank you. Okay, so good evening, everyone. We'll be starting with our presentation very soon. And I really appreciate all of you guys for giving this overwhelming response for the webinar. I could see that I already have more than 100 registration from our college. And this webinar I have particularly organized for students, PG students, UG students, faculties, and alumni of our college. So only students and alumni from our college and faculty from our college can join this webinar. So we'll just wait for 1 or 2 more minutes and I'll get going with my presentation. Okay, so I'm starting my screen share. I just want confirmation from one of you that you can see my presentation here. Can you see my presentation?
Yes, sir.
Yeah, that's great. Okay, so here we go. So good evening again, all of you. What I'm trying to present here today is a very brief webinar, because I've been conducted webinar about dentistry and permanent residency in Canada since more than a year now. So I have compiled all the information there is about the permanent residency, about the dentistry in this one webinar, and I'll try to make it as short as possible. Okay, so if you have any other questions or any other doubts, you can meet me in college and I'll be able to answer those questions. All right. So what is dentistry and what is permanent residency? These you already know about what dentistry is, and you have got the idea about it right now because most of you people are in internship or in your final year. So dentistry in Canada is different than what we have here in India. There are few things which are completely different. So I'll be talking about all those things as well. And there is one other thing which is called as permanent residency. So what is permanent residency? What are the benefits of permanent residency and all those things? We'll be talking about that as well. So people are still joining. I need to admit them manually. So just give me 2 minutes. Okay. Just 2 minutes. Can you see my presentation, all of you?
Yes, sir.
Okay. So my today's agenda is about spreading the knowledge, about spreading of knowledge of how dentistry is, how it works in Canada, and what you should be aware of in or if you are really interested in immigrating to Canada as a dentist, and if you want to practice dentistry in Canada. So what happens is I've seen this trend during so many years in our college. Many of our people, many of our students, they are settled in many other countries, different countries all over the world, mostly in USA, Australia, Canada. So what I want is I want to share the knowledge which is there about Canada. I just want to talk exclusively about Canada here, no other country. So the problem is many students, they are very eager to immigrate to Canada. They want to go abroad, but the problem is they don't have enough knowledge. They don't know about the things properly. So what I've created this platform where I share each and every information that you need when you think about immigrating to Canada as a permanent resident, or you think about immigrating to Canada as a international student. So that is what being a teacher, I believe that sharing knowledge is very, very important because it empowers someone who that needs that knowledge desperately, and it is very easy for them to make a consent decision about it. Okay, so what I'm going to do today is I'm sharing the knowledge which I have, and I can tell you that it is very difficult to share each and everything in just short duration. So I'll cover maximum most important points. All right. So once you get that knowledge, once I share this knowledge, you can get whatever necessary for you, and you can make a decision about whether you really want to immigrate to Canada or not. All right. So what I'll be talking about is dentistry in Canada, how dentistry in Canada is, what is NDEP equivalency process, examination and NDEP certification process, then what are different types of educations that you can avail, you can get admitted into in Canada as an international dentist, and lastly about most important thing, which is the permanent residency. All right, so these four factors are the main things that I'll be talking about today. Just a brief introduction about myself. I am Dr. Abhijit Patil. I am Associate Professor in Department of Prosthodontics in Bharati Vidyapith Dental College and Hospital, Pune. I am founder of a unique organization which is called as International Dentists Canada. And I'm accredited speaker for the subject of prosthodontics with Maharashtra State Dental Council. I am member of International Congress of Oral Implantology. Also, I'm reviewer for international journal like International Journal of Prosthodontics and Restorative Dentistry and Dentistry Open Journal. That's just a brief review about myself. I hope you know about me. Okay, so coming to Canada, what exactly you need to know? Just a brief introduction. Canada is a country which is situated in North American continent, and it is the second largest country in the world area wise. Okay, so it is mostly famous for, you know, the things, the Niagara Falls, the beautiful downtown Toronto skyline. Then you have very famous Rideau Canal. If you see that canal, it just get converted into a ski track in the winter time. So that is what Canada is very famous for. It's notorious winter. But if you can enjoy that winter, that will be the sweetest, beautiful thing that you can ever have. Then the Banff National Park, which is in the state of Alberta. So by far, you'll see this Canada is one of the most beautiful country I have ever seen. And these places like this make it very, very beautiful. All right. So This is just a brief review about Canada. Now coming to dentistry in Canada, how dentistry in Canada is different than dentistry in India or anywhere else. So in the dentistry in Canada, it is governed by basically three bodies. The first is the CDAC, which is called as a Commission on Dental Accreditation of Canada. What this body does is it accreditates, it recognizes the programs in Canada. So the programs, dentistry programs related to dentistry, which are in Canada or from outside Canada. So the programs which are accredited or recognized by CDAC, those people can get license to practice dentistry or related profession in Canada. So any degree which is not accredited or not recognized by Canada, you have to obtain the licensure from designated body. So which is that body? I'll tell you about it. So the second thing is, second organization, they are called as DRAs. DRAs are dental regulatory authorities. So now in India, we have Dental Council of India, so which governs everywhere, all the dentistry profession all over India. So in Canada, we have something called as DRAs, Dental Regulatory Authorities. For each province, they have their own DRAs that control, that recognize, that keep the track of dental profession in that particular province or that particular state. So for example, in Ontario, state of province of Ontario, the DRA is Royal College of Dental Surgeons of Ontario. Okay, so you have to register with those DRAs in that particular province if you're interested in practicing dentistry in that particular state. Okay, then the third is very important for us, which is called as an NDEB. It is National Dental Examining Board body. Okay, so what this board does is it maintains the standard of dentistry in Canada. So how it maintains the standard of Canada? If your degree is accredited from CDAC, the degree which are accredited in Canada by CDAC, it consists of degree that you get, dental degree that you get from all Canadian dental faculties, then the degree DDS, DMD or BDS degree you get from USA, then from Ireland, then from Australia, New Zealand. So if you have done your dentistry from these countries, your degree is accredited in Canada. Then you have to just go through NDEB certification process. Okay, and if your degree is from any other college or any other country, then your degree is considered as a non-accredited degree. So if your degree is non-accredited, then you have to go through NDEB certification process, followed by, NDEB equivalency process, followed by NDEB certification process. Then you can register yourself as a licensed dentist anywhere in Canada. Okay, so these three bodies. Apart from that, there is Canadian Dental Association as well, but these three bodies are very important if you're interested about dentistry in Canada. Then coming to the faculties or universities which are there in Canada, there are only 10 dental faculties or 10 dental colleges. Okay, so you can imagine about it. In India, we have somewhere more than 400 dental colleges in India. In Canada, there are only 10. Out of that, 2 are completely French. So these are University of Toronto, Faculty of Dentistry. Dalhousie University of Toronto is in Toronto, Ontario. Dalhousie University, it is in Halifax, Nova Scotia. Then you have University of Western, which is again in London, Ontario. Then University of Manitoba, which is in Manitoba. Winnipeg, University of Saskatchewan, which is in the province of Saskatchewan. Then you have University of British Columbia in Vancouver, University of Alberta, then McGill University, Faculty of Dentistry, which is in Quebec. Quebec is the French part of French province of Canada. In that, they have 3 dental faculties. Out of that, McGill is the only dental faculty which offer their programs in English. Then University of Montreal and University of Laval, they offer programs only in French language. So if we see, we have only 8 dental colleges to focus on if you want to get your degree or your education related to dentistry. Okay, so these are 8 dental or total 10 dental faculties which are there in Canada. Now, coming to some myths and coming to some facts. So what are myths and what are facts? We always get to know that in India, that dentistry is saturated. Dentistry is saturated. So what do you mean by that? Dentistry is saturated. We see that there are more and more dental clinics which are happening there, which are there. But the thing is, everyone wants to practice in metropolitan city. No one is focusing on the countryside. No one is focusing in the rural areas. So there is absolutely necessity of dentists in those areas as well. So if you see population to dentists in India, we are still falling short. We just see that dentistry is saturated because we want to practice only in the metropolitan area. So, but what about dentistry in Canada? So if you see about dentists in Canada, so all these figures I'm talking by from a official Canadian government websites. Okay, they are not from any third-party websites or any third-party organization. They are officially published by government of Canada. So if we see the unemployment rate, the national average of unemployed for, if you consider for all professions in Canada, it is close to 5.8% in Canada. But the unemployment rate of dentists in Canada is 0.09, which is way lower than the national average of any profession. Okay, so that is very, very good. But this is again related to few things, that dentists in these 0.9%, they might not be practicing dentistry, or they are practicing dentistry in two remote areas of Canada, like there is a few territories in Canada. Okay, so that is why if you see the picture is clear, only 0.9% dentists are unemployed in Canada, and which is in contrast to the national average of all the profession, which is close to 6, which is 5.8. So that is very, very good news. Why this rate is so low? Because 87% of dentists in Canada, they are self-employed. Self-employed means they have their own clinics. Okay, rest 13% dentists, they either practice in hospitals, they are either practice as a consultant to various dental clinics. Okay, so this is what the picture is in Canada, and these figures are officially published by Canadian Occupational Projection Systems. Okay, it is a body which sees the projection, how the outlook of any profession in Canada. Then one another interesting fact is, if you see that what they do is they do the outlook projection of any profession in Canada for 10 years. So this is for next 10 years, from 2018 to 2028 to 2029. So what they have observed is that there will be total 12,000 job postings, okay, new job which will be available for dentists, and there will be only 7,000 dentists to fill these job postings. So that is again very interesting fact. If you see, only 7,000 dentists will be available to fill 12,200 jobs which will be available in next 10 years in Canada. So that is again a very positive news if you are thinking about immigrating to Canada. Then this is the projection, what will be the job opportunities and why the job opportunities will be created. So there are three factors which are associated with it. First is the population growth. Why the population? Yes, population growth is happening in India as well. But what about population growth in Canada? If you see, Canada is the second largest country in the world area wise. All right. But the population is even less than the state of Maharashtra. So, but their immigration policy, if you look at their Canadian immigration policy, there is very friendly, and they are inviting immigrants from all over the world in huge numbers. So that's why the population over there is booming. So that is one reason why there will be more and more job opportunities. Second is the retirements which will be happening. This is the primary reason they are saying. The official website is saying the retirement will be the primary reason why these job opportunities will be created. So dentists, those who are practicing right now, they will be retiring. The median age of dentist in Canada right now, it is 47 years. Okay, though dentists, they get retired little bit late in their career, but still many dentists will be retiring in coming 10 years. So that's why these job opportunities will be created. Then one another thing, increase awareness for oral health. That is even happening in India. That is will happen more and more in Canada, because people over there, they are more aware about their dental problems and dental things. So that's one more reason. And to tell you the fact, right now I've told you there are only 10 dental faculties in Canada, 10 dental colleges in Canada. And if you look at the students who are going out from these colleges, they are not going to change in coming 10 years, because Canada has some strict restrictions about, because they have limited number of quotas of the seats in all dental colleges. So there is no point that there will be increase of the seats or any new faculty will be coming up in the Canada. So if you look all these factors combined together, you'll see that there will be shortage of dentists in Canada in coming 10 years from 2019 to 2028. So I will consider that as a golden period for any dentist to immigrate to Canada. So you can settle yourself, you can establish yourself properly. So now coming to very important point, wages, how much dentist earns in Canada. If you compare, so what I say, that never ever compare your payment or your income in Canada to Indian dentist. Okay, never ever do that, because you have different liabilities there than what you have here. All right. So what happens is, I have just taken main provinces in Canada, which is Alberta, British Columbia, Nova Scotia, Ontario, and Quebec. So the median age, the lowest that any dentist can earn is somewhere around 37 to 40,000 Canadian dollars. And this is again, if you have to see, that is not a full-time practicing dentist. This is a dentist who is practicing dentistry for a few days in a week, and maybe that dentist is practicing something else during the other days. All right. So then highest payment for any dentist can goes, or highest any dentist can earn, the limit is around 3,50,000 Canadian dollars. And if you see, that is mostly in case of Alberta. Okay, the province of Alberta, they have highest payment for dentist if you are running your own dental practice, or if you have your if you're working for any as a consultant dentist or a specialist. So lowest is 35 to 40,000 Canadian dollars, and highest is around 4 lakh, 3,50,000 and 4 lakh Canadian dollars. Now coming to the programs. So as I told you, our degree is considered as a non-accredited dental degree because it is not accredited or not recognized by CDAC. Okay, so that's why our degree is considered as non-accredited dental degree. So what we have to do if our degree is non-accredited? So we have two options. One is to get the NDEP certification process, because you can apply for NDEP certification only if your degree is accredited. So if your degree is not accredited, you have to go through either the degree completion program, or you have to go through an NDEP equivalency process. Okay, so what is the difference between these two things? I'll explain in short. So coming to NDEP equivalency process. So what happens is, it has something like you have to do your application and you have to do your credential evaluation from NDEP. Okay, so you have to send your application, you have to send your profile and everything, the required documents. If your application is approved, then you will be able to sit for the first examination, which is called as an assessment of fundamental knowledge. Once you pass that, then you can appear for assessment of clinical judgment, then you can appear for assessment of clinical skills. So these three examinations, AFK, ACJ, and ACS, they form NDEP equivalency process. All right. So once you pass ACS, then you can apply for NDEP certification process. That NDEP certification process is the process which even Canadian graduates, the graduates who have passed from Canadian Dental College, they have to apply for even this process. So what it consists of? It consists of written examination and OSCE examination. These are multiple choice examination, very easy to pass because you have already cleared your 3 examination. Okay, so you don't have to worry about this examination at all. So once you pass this examination, then you will get the NDEP certification to practice dentistry anywhere in Canada. All right, so this is in short about how you can obtain your license to practice dentistry in Canada. So we'll see in brief about NDEP equivalency process. Now, as I told you, NDEP, it stands for National Dental Examining Board. So it governs, it maintains the standard of dentistry all over Canada. So you have to go through NDEP equivalency process. Now, first examination I told you is assessment of fundamental knowledge. So now, if you see till now, the structure of this examination, AFK, ACJ, and ACS was completely different. NDEP has announced series of changes in these examinations starting from 2022. Okay, so these changes will be, I'm talking about this examination according to these new changes only. All right. So initially, before there were on 300 multiple choice questions. Now from 2022, there will be only 200 multiple choice questions. You can appear for this examination for maximum of 3 times. If you fail for 3 times, you won't be able to appear for this examination or end up equivalency process ever. So you have to make sure that you clear this examination in maximum of 3 attempts. Okay. So it consists of 2 sessions in a single day, 3 hours, 2 session. So 100 questions. Now there are 150 questions in one session. So you have to get 75 or more than that in order to pass this examination. All right. So this is about your assessment of fundamental knowledge. Then the second examination is assessment of clinical judgment. Now, according to the new changes, you can appear for assessment of clinical judgment. Means this is the process only after passing your assessment of fundamental knowledge. Before, once you clear your assessment of fundamental knowledge, you can appear for assessment of clinical judgment and assessment of clinical skills simultaneously. But with new changes, you can appear for these 3 examinations only in sequence. You have to pass one and then you have to appear for the next one. All right. So what assessment of clinical judgment examination is about? It sees how well you can judge about the clinical situations, how well you can come up with the diagnosis of the particular disease. So how it is based? There are case-based diagnosis, treatment planning, and clinical decision making and radiographic interpretation. So there will be photographs of the patient. There will be radiographs, IOPA, OPG of the patient. So and there will be a case which is described related to these photographs and these IOPAs and OPGs and cephalometry. So you have to see those evidences and you have to diagnose and you have to answer the questions which will be there. All right. So for one question, there will be multiple options, and there is not only one question answer which is correct. There will be multiple answers for that particular question. So you have to select whatever you feel right. You have to select those options. Okay. So case-based diagnosis, treatment planning, and clinical decision-making questions evaluate your ability to formulate a diagnosis and to make a clinical decision based on that diagnosis, how you can decide about the clinical treatment. Then the radiographic interpretation questions evaluates your knowledge in oral radiology and ability to make interpretation and diagnosis using radiographs, because these 2 things are very important to come to your diagnosis part, right? You have to evaluate the case clinically and you have to evaluate the case radiographically, and then you have to come to your diagnosis part. So this examination does that. Again, it has 150 questions, and you have to appear for you have to score 75 or more in order to pass this examination. All right. Then coming to the third and very important part, which is called as an assessment of clinical skills. There is the third examination. So once you clear your AFK, you will be eligible to apply for ACS examination. Now, one more important thing, again, assessment of clinical judgment, you can appear for this examination for maximum of 3 times. You have to pass this examination in 3 times. If you not, you have to go back to AFK and you have to complete your degree completion or bridging program. All right. So coming to the assessment of clinical skills, what is assessment of clinical skills? Now there are total 13 exercises that you have to do. All right. So if you pass in these 13 exercises, you will pass this examination. So there are criteria which is called as a B, D, and E. Okay. A and B you will pass. D is something which is if you will fail. If you get D in any exercise, you will fail D and E. All right. So this is the existing structure where you have to do these exercises: metal ceramic crown preparations for a maxillary anterior tooth, metal ceramic crown preparations for a mandibular canine tooth, metal ceramic crown preparations for a premolar or a molar, class 3 composite resin preparation, class 2 amalgam restoration, class 2 composite resin restoration. When I say about class 2 composite resin restoration and class 2 amalgam restoration, the cavity will be already prepared. You just have to do the restoration. Okay. And when I say class 3 composite resin preparation is you have to prepare the tooth for class 3. Okay. Then the endodontic access preparation, they can give you any tooth for the endodontic access preparation. And the class 4 composite resin restorations, class 2 amalgam preparation, full metal crown preparations, provisional crown restorations, rubber dam application, and infection control. So these are 13 total of 13 exercises that you have to appear, and you can fail in maximum 1 to 2 exercises. So what are the changes which are coming from 2022? That they will be changing few of these exercises. They haven't announced it yet. They'll be announcing in the fall season, means during September and October, what are these changes, and they will be introducing some new exercises. And there is very important thing that 2022 onwards, you have to pass all the exercises. Okay, you cannot fail in any exercise. You have to pass all the exercise. And you can appear for this examination for n number of times, multiple number of times. All right. So, but you have to clear this examination in 5 years from the time you have cleared your assessment of fundamental knowledge. So in 5 years, you have to clear this examination, no matter how many times you appear for this examination. Now, this examination is carried in different dental colleges all over Canada. But from 2022, NDEB is starting their own testing center for this examination in Ottawa. Ottawa is the capital of Canada. So these examinations, the last examination, ACS, will be happening round the year. So there won't be any backlog. Nowadays, there are too many backlogs for this examination. So, and the pandemic has made this thing more difficult. So from 2021, when they will be starting their own testing center, there will be very less backlog for this examination. Okay, and it will be happening all year around, like your NBD examination, which happens in USA. All right. So this is a basic structure of your NDEB equivalency process. Consists of 3 examination: assessment of clinical skills, assessment of clinical judgment, and assessment of fundamental knowledge. Now, there is something called as a degree completion program, which is also called as bridging program. Okay, if you want to practice, if you don't want to go through NDEB equivalency process, you can go through degree completion program. Now, you have to understand a fact that you cannot apply for degree completion program if you are not a permanent resident of Canada, or if you are not a citizen of Canada, which is completely opposite to that in case of USA. In USA, you can apply for DDS or DMD program even if you are an international student. Okay, but that is not the case in case of Canada. But there is a solution for this. I'll be talking about this later. So how to apply for degree completion program? Suppose you have the Canadian permanent residency, then you have to do the application to NDEB, and you have to get your profile approved. Once your profile is approved, you have to sit for the assessment of fundamental knowledge examination, and you have to score maximum marks for this examination, above 90. Okay, and then you can apply for different faculties, different colleges all over Canada for the DDS or DMD program. Depending upon the program, you'll be either admitted into second year of DDS or in third year of DDS or DMD program. Okay, so once you pass that DDS degree completion program, then you have to go through NDEB certification process. That is with your fellow dental Canadian dental students as well. Okay, that consists of NDEB, your OSCE and written examination. After that, once you get the Canadian NDEB certification, you can practice dentist. You can register yourself dentist anywhere in Canada. You can start practicing dentistry there with the DDS and DMD degree, whatever you have applied for. So now, what are these programs and where these programs are provided? So these programs are provided in these, and the names of this program is as follows. University of Toronto, it has International Dentist Advanced Placement Program. In University of McGill, it is DDS Qualifying Program. Sorry, this is Dalhousie University in Nova Scotia. Then Western, it is Internationally Trained Dentist Program. For University of Manitoba, it is International Dentist Degree Program. International Dental Degree Completion Program in case of University of British Columbia. University of Alberta offers it as a DDS Advanced Placement Program. McGill University offers Degree Completion Program. Now, very important fact. As I told you, McGill University is there in Quebec. Quebec is the French part, and Quebec have their own express entry system and their own immigration system, their own education system. So if you want to get admission into McGill University, you don't have to apply for AFK examination or NDEB. You have to apply for a completely different examination, okay, which is called as an Advanced Dental Admission Test. Okay, if you pass that, then you can apply for degree completion program in University of McGill. And in case of University of Saskatchewan, the program is called as International Dentist Degree Program. So all these programs except McGill University, you need to pass your assessment of fundamental knowledge examination, and on that basis and your BDS program, how you have done, what exactly you have done, and your career, your profile and your CV, you will be invited for the interview part. All right. So this is how you can finish your DDS or DMD program. So once you finish your DDS and DMD program, you have to appear for written examination and OSCE examination. These are two examinations which will happen in 2 days, a written examination 1 day and OSCE in 1 day. But from 2023, they will be starting with something called as an NDEP virtual OSCE. Okay, it will combine these two examinations, and the examination will happen in 1 day only. And when you'll pass this examination, you can register yourself as a dentist. Right now, written examination consists of 2 sessions, okay, where you have to appear for 150 questions, and the objective structure OSCE examination consists of 50 questions. And again, you have to get 75 marks to pass this examination. So if you clear your NDEP equivalency process or degree completion program, these examinations will be very, very easy for you to pass. Okay. So again, you have 3 attempts only to pass these 2 examinations. Okay. But from 2023, there will be only 1 examination, which will be called as NDEP virtual OSCE examination. All right. Now coming to specialist, if you have done MDS from India or any other country, which is the program, if the program is non-accredited, then the pathway, you can have 2 pathways. As a MDS or as a specialist, you can either go through NDEP equivalency process, or you can go through something called as a DESCI process. Now, DESCI is Dental Specialty Core Knowledge Examination. It is only for the candidates who have done their master's degree. Okay. So what is the pathway for this? If you are a non-accredited dental specialty program, you have to apply for the DESCI examination. You have to, if you pass this DESCI examination, then your result will be forwarded to the faculties where your particular specialty program is taught. And if you get admission, you'll be admitted into dental specialty assessment and training program, which will be a 1-year program. During that 1 year, they'll assess your specialty skills, your knowledge. And if you pass that, then you have to go through NDEP, a National Dental Specialty Examination. Even Canadian graduates who will be passing their master's program, they have to give this National Dental Specialty Examination. Okay. Even if your degree is accredited in Canada, you have to give this NDSE examination. If you pass that, then you can apply for a licensure to practice dentistry or as a specialist anywhere in Canada. So which faculties offer these programs? So if you see, there are only 4 dental colleges. University of Manitoba, which offers this specialty program in pediatric dentistry and orthodontics. University of British Columbia offer this program in endodontics, oral medicine and oral pathology, orthodontics, pediatric dentistry, periodontics and prosthodontics. Dalhousie offers this program in oral and maxillofacial surgery only. And University of Toronto, UFT, offer this in all branches. Now you have to see that in Canada, there is nothing called as endodontics and restorative dentistry. There is only endodontist specialty. Okay. There is nothing called as oral medicine and radiology. There is either oral medicine or radiology. Okay. So the oral medicine is combined with oral pathology. So you have to be careful about the program. If you have done endodontics and restorative dentistry, there may be some problems if you want to go through this DESCI process. Okay. So that is how after this, you can register yourself as a specialist in Canada. Now coming to the education part in Canada. So this is something that you people can look forward to if you want to immigrate to Canada as an international student and want to get enrolled into programs which can benefit you. All right. So you have to consider that you have to select a program particularly because after completing this education, you will be getting your work permit to work either for 1 year or 2-3 years. And once you get the work permit and you can work for 1 or 2 years, you can get a Canadian permanent residency, that is Canadian green card, and you can practice your profession and you can become a Canadian permanent resident. So how to become that? I'll tell you about this later. So what are the educational programs? I have classified these education programs into 3 categories. First are the dentist programs which are directly related to dentistry. What do you mean by directly related to dentistry? There are different programs. The one which I have talked about recently, which is degree completion program. okay, like DDS or DMD program, but you need to be a permanent resident or citizen of Canada in order to get this admission into degree completion program. Then the second will be master's program. So even as an international student, you can apply for these master's program. Now these master's programs are of different types. There'll be specialty programs in all the specialty branches: orthodontics, pedodontics, restorative dentistry, then periodontology, and all these things. So you can apply for these programs being an international student, but the competition is very tough and there are very limited seats which are available. So your profile has to be very good. You can apply for these programs being a bachelor's, being a BDS student, or being a MDS students. All right. Then there are research programs. Yes, these research programs are offered by different university. So these research programs are, you have to understand, after completing these research programs, you won't be getting license to practice dentistry in Canada, because those are academic programs. Those are not licensure programs. Okay. So you will be engaged in faculty education. You'll be engaged in research activities in Canada, but you cannot practice dentistry in Canada because you won't be getting license to practice dentistry in Canada. Then combined or joint programs, which has both clinical part and the research part. Okay. So you will get a license to practice dentistry in Canada along with a research degree as well. So these are the joint programs. So there are many programs which are offered. I have conducted a separate webinar on this educational program for international dentists in Canada, and that is a separate topic to discuss about. I'm just giving you a brief idea about these programs. Then there are second categories of program, which I call as a dental auxiliary program. Okay. In India, we don't see dental assistant being, we have dental assistants, we have dental hygienists, but they are not used to their full potential. But in Canada, if you have to be want to work as a dental hygienist or dental assistant, you need to have a license. Okay, otherwise you cannot practice these professions. So what are these dental auxiliary program? Denturists. Denturists are those people who can treat patient and they can prepare dentures for the patient. So they will be doing clinical steps as well as the laboratory steps for their patients. Okay. So they can open their own clinic. They can have their own clinic, but they can only treat patients for denture treatments only. Second are dental hygienists. Dental hygienists are those people who can also treat patients, but till some extent, and they can open their own clinics. They can open their old dental clinics and they can do some treatments, and they can keep some dentist as a visiting consulting faculty to do the advanced treatments. All right. So dental hygienists, they can make radiographs, they can do oral prophylaxis parts, they can do minor restorative activities, POR things, and all those things. All right. Then the next profession is dental assisting. So about dental hygienists, most of the dental hygienists in Canada, they are females. Okay. Mostly what I have seen so far is 99% of dental hygienists, they are females. Dental assistant, same thing. You need a license to practice as a dental assistant. Again, you can make radiographs and all these things being a dental assistant. Then you have dental office administration and a dental technologist. Dental technologist is a dental technician who can do the laboratory works and all those things. All right. So all these profession, as international student, you can apply for these programs, but the chances of getting admission into these programs are very less. So why I'm telling you these programs, because if you are immigrated to Canada as a permanent resident, then you can think about getting admission into these programs. All right. So if you don't want to go through NDB equivalency process or DDS, because future of being dental hygienists are also very good. Denturists, yes, very good. Dental technologists is booming again because of the CAD/CAM dentistry things and digital dentistry things. So these also can be considered as a good career prospects if you don't want to go through NDB cert equivalency process. Now, the third category is something called as applied health sciences. Now, these are not related to dentistry, means you cannot practice. There is no practice component which is involved in this. So what are these? These are the management or administrative kind of programs, okay, related to healthcare. So these are diplomas, advanced diplomas or postgraduate diplomas, or master's program in health administration, diploma or master's in health management programs, and master's science in management. Then you have healthcare informatics. So these are the programs which you can apply for being a dentist, either master's or postgraduate diploma. So how you can apply for, you can apply after finishing your BDS. So you have to select a program which is for 1.5 years to 2 years. Why I am saying that? And you have to see that this program is work permit eligible, meaning after completion of this program, you should be able to get work permit to work in Canada. Otherwise, you have to come back to your country. You have to come back to India. So that is not something that you want. So you have to see the programs which will offer work permit. So if your program is for 2 years, you'll get work permit for 3 years. So once completing your education and 1 year or 2 year of work experience, you can apply for Canadian permanent residency under Canadian experience class. So what is that? I'll tell you about in some time. Okay, so these are applied health science. Many BDS people, they are doing it just to get the permanent residency in Canada. But during completing this program, you cannot appear for NDEB. I will not advise you to appear for NDEB equivalency process, because if you want to go through NDEB equivalency process, you have to get full dedication for this program. Okay, so this is the program where there will be a route for you to get the permanent residency of Canada. Now, I want to talk about a special program which has been launched recently in Canada, which is called as a dental business management diploma, advanced diploma, which is very, very unique program. Okay, and I'm associated with one of the institute which is conducting or have involved in this program. So what the speciality about this program is, it is a 2-year program. You will get a work permit of 3 years after completing this program. And the best part about this program, that first 2 examination, if you see here, AFK and ACJ, the coaching for these first 2 examination is inbuilt in the program. It is the part of the program. So you don't have to waste 2 years doing another program and then coming back to the NDEB equivalency process. You can complete the NDEB equivalency process during the program. Okay, that is the best part which can ever happen. So there are many candidates who are interested, who are enrolled with me for this particular program. And if during these 2 years, if you pass the AFK examination, coaching will happen just before the final main NDEB AFK examination. And you can immediately appear for this AFK examination, NDEB AFK examination, the main examination. Same thing will happen with ECJ examination. You will be able to appear for main NDEB ECJ examination because the coaching is just before the main examination. So that is the best part. So after completing 2 years, even if you didn't complete, even if you fail in the main NDEB examination, still you will get the degree in the dental business management, which will help you to boost your career, because the career perspective are different. Many career perspective being dental business with the dental business management diploma program degree. You can act or you work for a specialty clinic. You can work for a clinic who have multiple branches to build their dental business and dental treatment and practice. And if you finish your degree completion or the NDEB equivalency process, and if you plan to open your own clinic in the future, this program will help you a lot. Okay, so it is pathway towards your permanent residency. It is very, very good program which has been launched recently. The first batch is starting from January 2022. And from next, the program will start in the fall session, which is in September 2022 onwards. So every time the program start date will be in September of every year, each year. Okay, so that is about a dental business management program. And the last part which I'm talking today is permanent residency. Now, this is very attractive thing, very fascinating thing that can happen with Canada. So what I have talked about before is dentistry in Canada, what educational program you can appear as a dentist in Canada. And now the third part is the permanent residency. What is permanent residency? Is a green card of Canada, like what we called as a green card. So permanent residency is it is a program which has become very famous recently for Canada, because they have prepared it, they have structured it in such a way that people with whatever they want, they are selecting people, those people who they want in Canada. So it is targeted, and it is very unique program which they have designed it in such a way that, so what the program consists of, it is called as how you can immigrate to Canada as a permanent resident. you can immigrate to Canada as a permanent resident with the express entry system. So what is express entry system? Express entry system, it is online system. There are three streams of express entry system: federal skilled worker program, federal skilled trades program, and Canadian experience class. Now, as a dentist or any other foreign national will fall under federal skilled worker program. And this is the program under which I immigrated to Canada as a permanent resident in 2019 under federal skilled worker program. And if you get education in Canada, and if you work in Canada for more than 1 year, then you will transfer from federal skilled worker program to Canadian experience class program, because you have Canadian experience of education and Canadian experience of work. Okay, so how express entry system works? It is a point-based system where certain criteria are used to calculate a comprehensive ranking system score, which is called as a CRS score, and it is out of 1200 points. So which factors or which criteria are included? Candidates marital status, age of the applicant, level of education, Canadian education, English or French or both language test score, Canadian work experience, foreign skilled work experience, valid job offer from Canadian employer, provincial nomination, and first blood relative of applicant, like your brother or your brother, real brother or sister. So you will get points for each criteria. So if for example, for case of age, the maximum you can score point is 110, 100. So if you are below 29 years of age, you will score full points for your age criteria. So as you go beyond 29, for every year, for 30, 31, 32, you will be losing 5 points. Okay, so at 29 till 29, from 18 to 29, you will get 100. After 29, if you turn 30, you will lose 5 points. All right. The level of education is very interesting part, because being a dentist, if you have a BDS degree, okay, that BDS degree is considered equivalent to a master's degree, because BDS degree is evaluated as a professional degree, first professional degree. So you will get score for a master's degree, not a bachelor's degree. That is not the case in case of if you have done engineering or something like that. A bachelor's of engineering is considered as a bachelor's degree only, but bachelor's of dental surgery is considered as professional degree, which is equivalent to a master's degree. So that is added benefit that we have being a dentist or a BDS. Okay, so again, Canadian education, you will go into Canadian experience class. Foreign skilled work experience, so you have to have more than 3 years of work experience in order to get full points for as a foreign skilled worker experience. Okay, if you have your real brother or sister, you will score additional points. Valid job offer, we are not going to get as a dentist, because to practice dentistry you need a license. So if you don't have license, no one is going to offer you a job in Canada. Okay, so English and French language test is the most important thing. Okay, because degree, yes, you have, age, yes, you don't have any control over that. But English, if you have to score a particular score, you have to give IELTS examination or CELPIP examination. And in that, in case of IELTS, you have to give IELTS general examination, and you have to score CLB 9. CLB 9 is, there are 4 modules in IELTS: listening, reading, writing, speaking. It is out of 9. So in listening, you have to score 8. And in reading, writing, and speaking, you have to score 7 or more. Then you will get a boost in your score. Okay, if you score less than that, then your score, you will lose 50 to 60 points from your CRS. And that is very huge. You cannot even miss 1 point. All right. So English language is very important. If you have additional French language skill, you'll get additional 50 points. Okay, if you have both the skills. All right. So that's how the system works. Once you put everything together, you will get your CRS score out of 1200. Now, the current trends are about 468 plus. So the IRCC, which is the governing body of Government of Canada, which is Immigration, Refugee and Citizenship Canada, they conduct a draw. Every month they conduct 2 draws. Okay, under Federal Skilled Worker Program, Provincial Nomination Program, or Canadian Experience Class Program. So in each draw, they will have a cutoff score. Okay, so suppose the draw happens now and the cutoff score is 468. So those candidates who have their score, CRS score above 468, they will receive the invitation to apply for permanent residency. If your score is below 468, you won't receive the invitation to apply for permanent residency. Okay, so once you receive the invitation to apply for permanent residency, you can prepare your application online and you can submit that application. And if your application is proper and properly submitted, then they'll approve your application and they will receive you, they will issue you COPR, which is confirmation of permanent residency, and you can travel to Canada as a permanent resident. Okay, that's a great thing because you're not in Canada, you have never been to Canada, but still you can immigrate to Canada as a green card holder of the Canada, as a permanent resident from India. All right. So what is that express entry system? You have online questionnaire which you have to fill. This is very short. Okay, the express entry system is very, very elaborated. Okay, it is very much in detail. So that's why there are immigration consultants and lawyers which do this process. So the online questionnaire, then you have to submit your profile, then you have to you'll CRS score will be generated, and if you get your invitation, then you will have to submit all your documents, and if your application is approved, you will receive your permanent residency. So what are the benefits? Once you receive your permanent residency, you can immigrate to Canada as a permanent resident. So what are the benefits of being permanent resident? So benefits of permanent residency, there are many benefits. Okay, so what happens is there are some distinct points being a permanent resident and citizen. So what benefits will be available to you as a permanent resident? That you can have access to social security and healthcare benefits, all the healthcare benefits that a citizen can have. Being a permanent resident, you can avail that. You have right to live, work, and study anywhere in Canada. You have protection under Canadian law, and you have right to apply for Canadian citizenship if you are permanent resident of Canada for more than 3 years. Okay, so you can immediately apply for Canadian citizenship. That is the best part, because you know what is thing about the, what do you say, green card in USA and citizenship in USA or any other European country for that matter. Okay, compared to that, Canada offers this thing is very easily, okay, compared to any other Western country. And what you cannot do being a permanent resident, till the time you are permanent resident, you cannot vote, you cannot hold office, a political office, or you cannot hold any position in Canadian military. Okay, these are the three things only that you cannot get being a permanent resident. But once you become a citizen, you can do those things as well. But you can see this, the healthcare is completely free in Canada for permanent residents. If you have your kid, then the education is completely free for that child till the 12th standard. Okay, so that is what these are actually very, very good benefit. These looks only 4 benefits, but there are multiple benefits under these 4 categories. All right, so now what are the benefits of being a permanent resident for dentists? Being dentist, what benefits we can have? So as I told you, you cannot apply for degree completion program like DDs and DMD until and unless you are a permanent resident or a citizen of Canada. Again, dental specialty assessment of training program, you have to be a Canadian PR or citizenship in order to apply for this program. And there are some other programs for that you need a permanent residency or citizenship of Canada. Then the provincial funding programs for education. If you immigrate to Canada as a permanent resident, and if you feel that you have to study, you have to do some kind of education, then the provincial government, the state government will offer funding for you. That is something called as, for example, OSAP, Ontario Student Assistance Program. That is in case of Ontario state, which offers, if you apply for this, they will pay for your tuition. Okay, they'll pay for your daily expenses and all those things. Okay, they'll give you bursaries, they'll give you scholarship, and out of that you have to pay. If you get eligible, you don't have to pay anything back, or if you are not eligible, you have to pay something back to the Canadian government after your education, and that is without interest. Okay, so that is the best thing. Then a financial institute can provide financial assistance for NW equivalency process. Now, if you immigrate to Canada as a permanent resident, being a dentist, so there are financial institute which will give you a loan, very low interest loan, just to clear your NW equivalency process. So that loan will be somewhere around 1 lakh Canadian dollars to clear the NW equivalency process. Okay, but you need to be a Canadian permanent resident in order to avail that. So it is offered only exclusively for international dentists. So you can see how special it has to be. Okay, then education program fees. So if you decide, suppose, for example, if you choose a dental hygienist program, okay, so if you apply for a dental hygienist program as an international student, your fees will be somewhere around close to 45 or 60,000 Canadian dollars for the program. But if you apply for the same program as a permanent resident or citizen, your program's fee will be half of that, being a Canadian permanent resident or citizen. So you can imagine the benefit. Your fees become more less than half. All right. So that is another benefit of being a Canadian permanent resident for dentists. So now, what are the future trends for this which are happening? So IRCC or Canadian governments, they have announced that they will be accepting close to 1.2 million immigrants in coming 3 years. But because of the pandemic situation, it has put to brakes, but it will start again. So their target was to invite 4,01,000 immigrants in the year 2021, around 4,11,000 immigrants in the year of 2022, and in 23 they want to invite around 4,21,000 immigrants. So their immigration is just booming. Okay, so if you are interested, it is the right time to apply for the permanent residency. And if you get lucky, yes, you can immigrate to Canada as a permanent resident. So imagine 1.2 million people will be immigrating, plus their families. Okay, they will be immigrating to Canada in coming 3 years. So that is a huge boost to the population. As I mentioned in the beginning of the webinar, that why there will be a shortage of dentists in coming 10 years. According to the projection, in coming 10 years, there will be shortage of dentists. Okay, so that's why the shortage will be. That is the one reason in front of you, that 1.2 million immigrants will be coming to Canada in next 3 years. All right. So putting everything into perspective, this is what your timeline will look like. All right. This is, I have prepared it being a dentist for dentist. So how the timeline will look like. So you have to do your ECA and IELTS. ECA is the education credential assessment, which evaluate your Indian degree and how much equivalent it to the Canadian degree. Okay, so as I told you, it is evaluated as a first professional degree, which is equivalent to master's. So then once your IELTS is clear, you can apply for, you can prepare your express entry profile. And then once you get your invitation to apply, you can start with the NDEP profile. NDEP profile approval takes around 6 to 8 months. Then once you get your invitation to apply, then if your invitation is approved, then application is approved, then you can immigrate, you can go through NDEP equivalency process or degree completion program. And once you finish that, you can get employment opportunities in Canada as a dentist. So that's how the timeline will look like. This journey is different for everyone. So some people may take 2 years, some people may take 3 years, some people, I've seen people who have taken more than 6 years, okay, to go through NDEP equivalency process, because they have their own challenges. So it is your own journey, it is your own path that you have to travel. So don't hesitate about it anytime. Okay, so if you are determined, if it is your dream to immigrate to Canada as a dentist, then yes, you have hard work in front of you. You need to have a dedication, and then surely it is not that difficult. You can surely do that. Okay, and you can practice dentistry in Canada, and it is, dentists are amongst highly paid profession in Canada, and you have too many social, financial, other benefits, healthcare benefits being in Canada as a permanent resident of Canada. Okay, and that is how our presentation looks like. The way to get started is to quit talking and thinking, and you have to begin doing the things. Okay, so your journey, if you are in final year, if you are in internship, your journey will start right now. You have to think about it and you have to plan it out. All right, and if you want to know more about these things, you can visit our website www.internationaldentistcanada.com. I have provided all my webinars on my blogs, all my videos, they are regularly posted there. And you can stay in touch on Instagram, Facebook, in LinkedIn and Twitter, where I post all the updates related to dentistry, Canada, and permanent residency in Canada. Okay, so thank you very much, all of you, for coming here and joining me here today. And I hope, because I couldn't provide each and everything in this short duration of time. There are so many things that you need to know in case of permanent residency, in case of if you are interested in education in Canada, if you're interested about going through end-up equivalency process. There are so many things to talk about, to tell you. So that's why I'm telling you, you can go through the website and you'll find all the basic information which is put up there. So if you have any other question, you can come and meet me, or you can contact me on my email, and I'll be happy to help you. So that's it for today. And if you have any questions, you can put it there. We can have this conversation, or we can have a question and answer session right now. So if you have any questions, you can put it in the.
सेमिनार चालू है 5 मिनट પછી આવો ને.
Hello, Kevin, your mic is on. Please, if you have any question, you can ask me. Any questions from you? You can put it in the chat box so I can answer those questions. We'll have a short question and answer session, and then we can finish with our today's webinar. So any questions, any doubt, or maybe you can go through the webinar, you can go through the website and you can have more information, look at the information, detailed information which is put up there, and you can mail me anywhere, or you can mail me, or you can message me. From Tarun, yes. Can you please talk a little about dental business management? Yes, dental business management, I told you. Dental business management program is a program which which is specially designed for international dentists who are interested in immigrating to Canada as a dentist and who wants to get a permanent residency. Okay, so what that program offers a unique opportunity where you can go through end-up equivalency process while you are completing the program. That is not the case until now, because student can go there as for business, dental healthcare management or other programs where you have to finish the program first for 2 years, and then you have to think about getting into end-up equivalency process during your work permit. But this program has something which is which will provide you the opportunity to go through end-up equivalency process right when you are getting education in Canada. So that is very, very important. And the start date for this first batch is starting in January 2022. After that, the batch will start from September every year. The batch will start in September. So if you want to know more about this program, please message me, or you can come and meet me. All right. So Dr. Ati, yes, kindly elaborate about healthcare management in dentistry. There is no healthcare management in dentistry. The healthcare management program is in general. Okay, that is related to healthcare management. So if you have complete healthcare management, yes, you can apply. You can work in any clinics who have their multiple clinics, franchisee or something like that. So you can take care of the management part of their dental clinics or their operations. Or you can work in a dental hospitals as a dental care administrator or management. You can take care of their practice business. So if you get into master's degree, do we still need to appear for end-up examination? That I told you that if you're a master's, if you're a prosthodontist, endodontist, anything, then you have two choices. You can go through end-up equivalency process, or you can go through DESCI examination. Okay, that is only for specialists. But I'll tell you a thing which is behind the curtain, which no one will tell you, which is not there. If you apply for DESCI, if you pass, the chances of getting into dental specialty and assessment program are slim, because they want you to finish with the end-up equivalency examination first if you want the admission into dental assessment and training program. Okay, that is the hard truth, but yes, it's there. So next question. Just a second. So that is from Nadia. Okay, I hope, Nadia, you got answer to your question. The next question is from, okay, so are there any short fellowship programs in Canada which are beneficial for us and would be useful if we decide to come back and practice in India anytime. It is not necessary that you have to see the programs which will give you permanent residency only. You can do all these programs, you can finish those programs, and you can anytime you can come back to Canada. It is not compulsion on you that you have to stay back and practice in Canada. There are many programs which are fellowship program, not like fellowship programs, master's program, or there are research programs which are there, good research programs which are offered there in Canadian dental faculties that you can do. And after finishing those programs, you can definitely come back to India and practice or do whatever related to that program. Okay, the next question is, what is more preferable, direct NW equivalency process or degree completion program? That is your choice. Okay, to be honest, that is something that you have to decide. If you want to go through NW equivalency process, NW equivalency process is considered as a short route, because if you clear all the examination in one go, you will finish NW equivalency process in 1.5 years. Okay, and then you can start practicing within 2 years. If you go for NW degree completion program, that is for 3 years. Okay, so it is depend upon duration. If you are interested in getting Canadian education, yes, you should be going for degree completion program. Or if you want to just get going on with your practice, you can select a NW equivalency process. That is your personal choice. There is no hard and fast rule for that. So next question is, what is the more preferable? Yes, that is all answered. We can prepare NDEB along with studying for other courses like dental assistant or hygienist. I won't recommend to apply for dental hygienist or dental assistant being a international student, because you might get rejection in your visa, because visa officer will ask you, you're already a dentist, so why you want to do a program which is inferior to your current education? Okay, you might get visa, but chances of rejection are more. And dental hygienist program is very cumbersome. It has a very hectic program. You won't be able to appear for NDEB equivalency process. If you are going through NDEB equivalency process, you should be doing only NDEB equivalency process, nothing else. Study, coaching, sleep, eat, nothing else. All right. So thank you so much. I hope you got answers to your questions. And yes, that's it. So thank you so much, all of you, for giving so wonderful response to my today's webinar. And I hope this was very helpful for you guys. And yes, I'll be available to you. You can message me, you can come and meet me. And if you have any questions, you can ask me anytime. Okay, so thank you so much for joining me here today, and hope to see you soon. So take care. Bye-bye.
Thank you, sir.
Thank you.
Thank you, sir.
All of you are welcome. And if you have any question, please do let me know. I'll be there to help you out. So we'll stop this meeting now, and thank you so much.